Everybody to this special meeting of the Humboldt County Board of Supervisors. This is Monday, April 6th, 2020, and we have a couple of emergency items to address here. That's the reason for the special meeting. I would like you to join me in a salute to the flag. Flag of the United States and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. As I said, we do have some emergency items here, but we're going to start with a time certain, kind of meeting with Congressman Huff. Federal situation and how we may or may not be helped in that regard. Welcome, Congressman Huffman, and thank you so much for being here.
Well, thank you for having me, Supervisors, and thanks for all your leadership during a difficult time. I see those of you that are in the chambers are doing good modeling by wearing your masks. I think it's really important for all of us to follow the latest public health guidelines, and certainly even if we are asymptomatic, all the evidence says that by wearing those masks, we can prevent inadvertently spreading the virus to others. And so you're doing a great job. And I have a similar face covering that I wear whenever I need to go outside of the house. I wanted to just invite a conversation on the CARES Act, which is the $2 trillion piece of legislation that passed a little over a week and a half ago. Maybe it's been 2 weeks now. The days are blurring together, but there's a lot in that legislation for local government, for community health centers, hospitals, for tribes, for certainly small businesses and individuals as well. It's really a remarkably broad piece of legislation with a huge amount of federal resources that have been made available to people. And so I'm happy to answer questions about it. But at the technical level, I want you to know that my website has just a huge amount of detailed information, frequently asked questions. If folks have questions about, their individual checks from Treasury, when they're going to arrive, how much they're going to be, all of that is available online at Huffman or at Rep Huffman. Just Google Rep Huffman, you'll go right to my website. But I'm here to answer any questions that you might have of me. And I think at this point, I'll just stop and see what's on your mind.
Supervisor Madrone.
Thank you, Madam Chair. Congressman, I really appreciate the work that you and the Congress is doing. In the community, people have heard about the possible $600 additional per week for unemployment. Of course, that's going to be an important linchpin for everybody, that unemployment scenario. And there's rumors floating around that California can't handle that. They have no way to be able to make those $600 a week payments. Do you know anything about that? Could you help clarify that situation?
So I have heard people having problems getting through to EDD. They're overwhelmed right now. The number of claims that have been made just dwarfs anything we've ever seen in our history. So I am hearing about long waits and sometimes the website being bogged down. Sadly, I don't have any ability to go around EDD. So anybody who's trying to get in the queue for that unemployment benefit still needs to go through the state, through the EDD. And the best advice I can give if you're having trouble is to contact Senator McGuire, Assemblymember Wood. They're going to have direct liaisons as state legislators with EDD, and they might be able to move things along a little faster. But it's all got a huge amount of federal money has been put on the table, but it's all being pushed down through the states and through EDD.
Great, thank you. I will contact the senator on that. And I guess the other piece to that is I've had a lot of calls from people who were previously self-employed, small businesses, and of course many of those are collapsing, and they don't necessarily expect to go back to that business because of that scenario. and many of them are being told they don't qualify for unemployment. Again, this is probably something I should talk with McGuire about because it's really a state issue of eligibility. And my understanding for the public is that even if you had a business and were self-employed, if you are currently not employed in that business and you are willing and able to look for work, for full-time work, just because you were self-employed previously does not disqualify you. But I just wanted to get that out to the community because many people think they're not qualified as a small business. So I will contact Senator McGuire again and connect with him on that. Thank you.
But Supervisor Madrone, I can confirm that you're correct in what you just said. The CARES Act temporarily expanded unemployment insurance benefits for the period of February 15th through July 31st, so that it now does include independent contractors and gig workers and consultants that previously might not have been eligible for unemployment. So you're absolutely right, and I can give you a specific answer to that right now.
That's great. Thank you very much.
Are any other members of the board with questions or comment for Congressman Huffman? Supervisor Bass?
Well, thank you. Actually, thank you for being here with us, by the way. This is actually for Supervisor Madrone as well. I have some information regarding exactly that last question that he asked for. CSAC's been working on that a lot, so perhaps I can help clarify some of that too. So thank you.
Excellent.
Thank you, Supervisor Bass.
This is
Supervisor
Wilson.
Supervisor Wilson?
Thanks. My question really, and thanks again, Congressman, for being here and reaching out to us. Is there anything, I know that you're also in the midst of proposing some legislation, maybe moving things forward for additional help and additional efforts. Is there something that you would ask of us in terms of in support of the efforts that you're doing?
Yeah, thanks for that question, Supervisor. So I think you're going to see at least 2 more waves of legislation from Congress, probably starting as soon as a week or 2 from now. The first will likely be a CARES Act 2, sort of a follow-on, because what we've seen is that all of the individual assistance and the funding for health centers, hospitals, tribes and small businesses and nonprofits is being immediately snatched up. The demand for this kind of help is beyond anything we could have anticipated, unemployment benefits being another good example. So we're going to have to plus up all of those things. And as we do that, look at ways in which the first wave, might have missed some things. So to the extent that you are finding any parts of our community that aren't getting help that they need through these existing programs in the CARES Act, let me know. And I'll try to make sure that the CARES Act 2, fills in those gaps. Now, the next wave beyond that, I think, we're sort of thinking about the immediate mitigation phase and then the recovery phase. The next wave will begin to look at the longer term and our economic recovery, and infrastructure has got to be a huge part of that. So we've had lots of conversations about what should be in a big, bold infrastructure package. I continue to invite feedback from Humboldt County and the rest of my district on that. But you can bet that there'll be a huge push for not just transportation infrastructure, but the greening of our energy grid, broadband build out to underserved areas, and all aspects of infrastructure, including natural infrastructure. I'm going to try to make sure tribes and our national parks and other kind of maybe not often thought about as infrastructure, but they really are. All of that needs to be in the mix, and I welcome specific suggestions. Fisheries is another one. There's a little bit of help for fisheries in the CARES Act. I think not nearly enough. I'm going to try to make sure the next wave includes things like working waterfronts, again, infrastructure, and things that'll be meaningful to parts of Humboldt County for sure.
Thank you, Congressman Huffman. Any further comments or questions from the board? Supervisor Madrone?
Thank you, Chair. One, we really appreciate the money that's coming down for Project Room Key and some of these other components for the homeless population. That's crucial, but that's really the tip of the iceberg. There's a whole lot of people with SUDs, substance use disorders, and other kinds of things that are not going to be able to come into those kinds of situations. And so there's a lot of talk around California, different communities looking at different options, whether it be safe parking lots for those that have a car, or emergency camps in parking lots, or all other kinds of things. The problem there is there's no direct funding to really be able to assist the county or the nonprofits in helping to manage and run those camps. So I see that as a big missing link. Again, there's a lot of great things that are happening, but that's, 70, 80% of the homeless population are not going to come into Project Room Key. So we need more help in that arena, I would say.
Yeah, I know that Humboldt County and lots of local jurisdictions are struggling right now, not just to make sure that the needs of the homeless community are met and that they don't have outbreaks of COVID-19, but also that we look at keeping people out of homelessness. And certainly with all of the economic fallout from this crisis, people are going to struggle to make their rent payments and to make their mortgage payments. So I guess a couple of points there. First, if there is a federal connection to either a federally backed mortgage, if someone is struggling to make those payments, or if they are a renter in a property that has some sort of federal backing, either, again, a federal mortgage, or if it's a HUD connection, Section 8 or otherwise, there will be relief. There's going to be several months of deferral available to them on either their mortgage or their rent payment. And then there's a little bit more at the local level and at the state level. I know there's lots of talk about a moratorium on evictions and relief for renters and homeowners. To the extent that you, the County of Humboldt, incur costs for doing something like that because of the COVID-19 crisis, and it wasn't previously in your county budget, you should be able to include that in your claim for the local government assistance that was in the CARES Act. So I just want to emphasize that. Anything that you hadn't budgeted for and that you have stepped up and done as part of your response to this crisis, you can draw down that funding that we have made available. Now, because Humboldt is less than 500,000 people, you're going to have to go through the state of California to get your pro rata share of the national funding that's been made available. Counties and cities that are bigger than 500,000 get to apply directly to Treasury, but you're still going to get the same pro rata share that would ordinarily come to you, and you can use it for whatever type of costs you're incurring to deal with this crisis.
Supervisor Bohn?
Yeah, Congressman, is Ben Carson going to come out with an eviction? I keep hearing that HED is going to come out with a eviction process or a guideline to follow on a national level. And I've heard this 3 times now, and since your office is just down the hall and 10 blocks away, I wondered if you could answer that.
Yeah, Supervisor Bohn, my understanding is that there's already a moratorium on evictions for HUD property. So the answer, I think, is yes, but I think you're going to see a lot of additional details. A lot of this stuff is still rolling out. So even many of the programs that I've outlined for you, the agencies, generally Treasury or IRS, still haven't posted a lot of the detailed guidance that we're waiting for. So, let's keep checking. If there's something that hasn't yet been answered by HUD, my office is happy to work with you to get those answers. But I think the short answer is, yeah, there's going to be several months of forbearance against evictions in HUD properties. That is clear.
I think I was wondering if the Secretary was going to take it one step farther and be overarching and cover all rental properties.
Hey, we can get you that answer, Supervisor.
So I had one quick question, Congressman Huffman, with regard to all of the federal programs. I mean, one of the things that we were talking about early on, which seems like years ago, but was probably only a couple of weeks ago, was just how quickly the federal government would be able to kick those funds down with regard to, say, for instance, the 75% share of Project Room Key and things like that. So what's your sense in terms of the federal government releasing those funds?
Well, many of them are going to come as block grants through the state. So it's just going to depend on which, particular benefit we're talking about. And I don't off the top of my head, Supervisor Fennell, know for that particular HUD program, whether that comes down as a block grant or whether there needs to be a direct application to HUD. We can figure that out together for sure, but a lot of it is going to come down through the states.
Thank you very much. Any further questions or comments from Congressman Huffman? If you wouldn't mind, Congressman, we actually, since this is an agenda item, should invite the public. And so when, now that we are ready for public comment, I would like to ask those attending Zoom to push *9 and to raise their hand. And we'll just give them a couple of seconds and see, we do have some. Okay, so Ryan, who's our clerk of the board, will tell us when they're ready. We're ready to go with the first question from the public or comment.
Hi, this is Tracy D'Amico, Deputy Clerk of the Board, and I have the following public comment from a constituent.
It is my understanding that all non-essential public meetings or hearings are to be postponed. Is this true? Is the hearing for the proposed termination of our current county council, Jeffrey Blank, scheduled for Thursday, April 30th, deemed to be essential? Why has it not been postponed? The logistics of public participation in Humboldt County's hearing of the decade may not be practical. Testimony of current and prior county employees, including all members of this board, potential public comments by possibly tens, if not hundreds of county residents is not practical. County Council Blank has been on paid administrative leave for over a year. Have the subpoenas for witnesses been issued? To date, the public has not heard
I think there's some kind of misunderstanding here. This is not public comment on items not on the agenda. This was public comment for Congressman Huffman. Any public comment or questions for Congressman Huffman? Okay, seeing none, thank you very, very much, Congressman. Really, really appreciate you taking the time. I know just at the local level how busy we all are, even though we're not very visible, and I am sure that that is true in spades for you. So thank you so much for taking the time to join us today.
Well, thank you, Supervisors, and I really want to commend you for continuing to keep the functions of local government going during a really difficult time. These workarounds that we have with video conferences and others are not anyone's first choice of how we'd like to be working. I wish I could get in my car and take that beautiful drive up to be with you in person. But I think we are going to get through this. Humboldt County is doing a great job, in my opinion. On a per capita basis, you've got a significant number of COVID cases, but all of my indications are you're doing a fantastic job. Everybody is respecting shelter in place. So please keep it up and call on us and my team whenever we can be helpful. We're going to get through this together.
Thank you very much, Congressman. And you be well.
Thank you.
Stay safe.
You too.
So that will bring us to our next item on the agenda. This is actually modifications to the agenda. I'm wondering if CAO Nielsen is available.
I am, and there are no modifications to the agenda.
Thank you very much, CAO Nielsen. That brings us to our consent calendar. There's one item on the consent calendar. It's a ratification of the local emergency proclamation due to the COVID-19 public health emergency, and I will entertain a motion.
I would move
that we approve it.
Second.
We have a motion and a second. Any public comment on this item? Again, if you're joining us by Zoom, please push *9. We have the same public comment, I believe. Welcome. Okay.
Hi, Estelle. It's Tracy. Can you hear me?
Yes, we can hear you, Tracy. Thank you.
I'm sorry, I didn't hear the prompt. I have a message from a constituent. Here it is.
Thank you. This is again a comment on the consent agenda, right?
Correct.
Thank you.
Hold on just a moment.
Resolution proclaiming the existence of a local emergency dated 3/30/2020 by our sheriff. It is further proclaimed and ordered that during the existence of said local emergency, the powers, function, and duties of the emergency organization of this county shall be those prescribed by state law, by charter ordinances and resolutions of this county and by the County of Humboldt Emergency Operation Plan as approved by the Board of Supervisors on April 7th, 2015, until its termination is proclaimed by the Board of Supervisors of the County of Humboldt, State of California. And it is further proclaimed and ordered that the existence of said local emergency, the powers, functions, and duties of Director of Emergency Services, and his or his designee shall be those prescribed by state law and the ordinances, resolutions, and approved plan of the County of Humboldt in order to mitigate the effects of said local emergency. What is the approved plan, and is it easily accessible by the public? How? Has it been updated to reflect the ever-changing situation we are in? Why not? Does it reflect the common sense of now recognized use of masks or some sort in public? Why not? Where are yours? Please avail yourselves of 5th District Steve Madrone's common sense when updating the plan. Circumstantial evidence shows that our airports have been and are our primary link to infection, not our road system. A few signs are not sufficient to protect our health, safety, and welfare. A county lab tech or contracted county lab tech through Open Door should screen and test the alleged 17 people and crew that arrive here twice daily. Please follow the actions taken by the Humboldt tribes. They are the tip of the spear, and the county's efforts are perceived to be the butt of a bad joke in comparison. Please no more busing students back. The assertion of the virus being transported here by vehicular travel is disputed by the fact that the contiguous counties to Humboldt have 1/10 approximately the cases, and it is likely that some of their sick were infected by our residents. No, the stats cannot be tainted by claims that we test more.
Thank you.
Thank you for that comment. Any further comment on the consent agenda? We have another one? Oh, raise your hand if you have any, if you have a comment on the consent agenda, which is the ratification of the local emergency proclamation. You raise your hand by pressing *9. Thank you very much. So we have a motion and a second. All those in favor, please indicate by saying aye.
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 Opposed? None? Passes unanimously. And I do want to thank the sheriff for being on the ball there and making sure that we do have that proclamation in hand, as the things that we discovered and talked about earlier are all linked to being officially on the record as being an emergency. We all know we are, but paperwork follows. So thank you for that, Sheriff. So we have 2 items brought to us by board members, and that's usually the case with the flow of our meeting. However, I'm going to jump to presentation from Public Health because I know they are super, super busy, and we don't need to ask Dr. Frankovich to sit here listening to everybody else. Dr. Frankovich is our health officer, and Michelle Stevens is the director of public health. And first of all, I just want to thank you so much for everything you're doing, and I hope you get some rest sometime because we need you to keep going. Welcome, Dr. Frankovich and Director Stevens.
Thank you. Thank you so much. Everybody hear me?
Yep.
Okay. Just to provide an update on status in terms of cases and such, people are probably aware globally we've exceeded 1 million cases. I believe we're close to 1.3 million cases of COVID at this time, with 71,000 deaths. So some sobering numbers for sure. In the United States, 350,000 cases confirmed, with approximately 10,000 deaths. And then in California, 15,000 cases and 350 deaths. Here in Humboldt, we've conducted over 1,000 tests between our local laboratory and the commercial laboratories, which I think is an amazing testament to the work going on here. We are a small public health lab, and the staff is working tirelessly on this. On April 4th, we did report 44 cases of confirmed COVID infection. A total of 3 individuals have required hospitalization. We are now identifying data by the type of case it is, so contacts of cases, of known cases, travelers who are confirmed cases, as well as community transmission. And those are cases for whom we have not, after lengthy investigation, been able to establish either contact with a known case or known travel that would have put them at risk. So I'm hoping these numbers will be helpful for the public going forward. We also have a category of under investigation, and those are cases that we are still looking at and trying to make the determination of the appropriate classification. We are still exceeding state and national rates in terms of testing our population. And of course, one of the issues with doing a lot of testing is that we will identify cases. That was the purpose of this. And it helps us all, because what it leads us to is one of the critical pieces of our response, which is the contact investigations that we do. I think we've been talking a lot about these lately, and people are understanding that these contact investigations begin with a single individual who is confirmed, and then they proceed into looking at that individual, all of their contacts, determining which are close contacts that are of concern, and then reaching out to that next tier of individuals to assess them for symptoms and the need for quarantine. So these investigations, obviously individuals can tell with our total number of cases. We are spending a lot of time and resources on doing this, and we think it's important because right now it's something we can do in addition to the sheltering in place to try and increase distance between these individuals and anyone else in the community and reduce transmission of cases. So it's still, we feel, critically important. At some point along the way, we will move into a phase in which we are not doing this because transmission is so widespread, but we're not there yet. So it's an important tool. The other piece that public health is focusing greatly on is surge capacity. So working on what we need to have in place to respond appropriately if we have, as we have an increase in number of cases, an increase in number of people who need hospitalization and critical care. So that planning really goes to issues about looking at what are our skilled nursing facilities set up like, what about EMS and their responsiveness and how we can work well to make sure the patient flow moves smoothly. Hospital bed capacity, ICU bed capacity, ventilator capacity, looking at alternative care sites that can offer us additional bed space for people who don't need the high acuity care that takes place within the hospital walls. And then a host of other issues that go along with surge planning. So that's a very active part of what we're doing right now with our community partners, including inpatient facilities, skilled nursing facilities, as well as EMS, outpatient medical groups, that sort of thing. So it's going to require everybody adapting their practices to meet the needs as we go forward. But again, we're a small county. And we need to use our resources wisely, and that's why shelter in place is so pivotally important here, because we need to have cases arise on a gradual basis rather than all at once. That will help everyone stay safer. I did issue a recommendation in this past week about masking. I have a bandana, but I found with practice it doesn't work very well in front of a microphone. But that's what I'm using when I'm out in public right now. I want to remind people that what we actually made a recommendation for is facial coverings. This does not require a mask. A bandana can be used, a scarf can be used, a mask, a cloth mask can be used. And I think it's really important that people focus on that because we do want to conserve the higher level masks for healthcare workers, first responders, those individuals who are not able to shelter in place, need to be out delivering our healthcare services, and we're all going to be counting on them as this moves forward. So protecting them is extremely important, and I encourage people to focus in the general public on acquiring masks that do not use those higher level resources. And that's all I was going to mention today, and if there are questions.
So any questions for Dr. Frankovich? Let me ask, go ahead, sorry, Supervisor Bass.
I was actually following the protocol and pushed the raise my hand button. So we got this new system is going to be getting used to. But yeah, Dr. Frankovich, I don't know how you do it, and thank you for everything you're doing.
Thank you. Our staff is looking a little
deserve a long
tired
rest eventually. But you know, one of the things I wish I'd said when we were on with the congressman was you and I had a little conversation right before the meeting about, you know, the feds and the state wanting to help us out, but they're not always telling us what they're doing. And, you know, that seems that it could cause complications. So perhaps we should try to address that, you know, with the congressman another time. And I also wanted to mention, you know, I think we get a lot of flack for not having enough tests. And I think, you know, compared to the rest of California, we're actually, and this number of people we've tested, I think we're doing fairly well. On Saturday, the governor in his address basically said he owned the issue of not enough tests. I think he recognized that local governments are really struggling. So I am curious what you see as, everything he said, do you see the state sending us more tests, or how do you see what he said actually happening? You know, how is it going to get down to us? Are we really going to get any more ability for more testing, given on what the state said?
Sure. Well, I think there's I guess two issues there. One is obviously we would love more testing. It would be helpful for us from a surveillance standpoint to be able to offer as much testing as possible. Frankly, to do more testing within our own lab, we actually just need to be able to use a process that is quicker than what we're doing now and less reliant on microbiologist time. That testing is there. We actually do have the equipment that would allow us to do that and adds additional testing. We are working on getting reagent, the sort of setup that we need to actually do the testing. So that's something that we hope will come along. But again, everyone is looking to do this. And so we are part of a queue as we move forward to get that capability. I think, again, the amount of testing we're doing within our walls has been ramping up, and we're now running 50 tests per day, sometimes more. And our goal is to be able to do at least 60 standard on a day. And so that will be helpful as well. The commercial lab testing is another big resource, and they have also had their struggles moving forward and getting everything they need in place to really maximize testing. But certainly they are ramping up, and while we were way ahead of what we saw commercially in this area, we actually are just slightly ahead now in terms of testing between public health lab and commercial. What would help us would be, you know, something that was something dispensed by the state, you know, when they initially were looking at the, for instance, mobile testing units that they were establishing in the lower part of the state. That type of thing that came to us where it was equipped and we could set up easily and have assistance with staffing and testing would be outstanding, but I don't know that that's going to happen at this time. So in the meantime, we're being very judicious about our testing, trying to test as much as we can, making sure we can accommodate the testing that has to happen quickly here. and looking always to be able to expand our internal capacity while we wait for some assistance from the outside as well.
Thank you. Any other questions or comments from Dr. Frankovich? Supervisor Madrone?
Thank you, Dr. Frankovich. I happened to see a video. There's a lot of stuff going online all over the place. There was a video with Bill Gates. I don't know if you caught that one.
I didn't see it, but about the testing they're working on?
Yeah, he talked about the TED Talk that he gave, half a year ago that pretty much predicted this whole scenario and was really trying to raise the alarm to national governments that we're not prepared. And this is coming, and we better get prepared. Of course, we didn't get prepared nationally as we should have. Now we're doing a great job of trying to catch up and do things. But he talked a lot about some things that I thought were interesting because I'm getting a lot of emails and phone calls from constituents that are wondering, when's it going to be over with, right? Everybody's asking you that question every day, I'm sure. And nobody can really predict that. What we see from the evidence from the Spanish flu in 1918 is that it came in several waves. And Ferndale masked up immediately and did really good in wave 1. But then they lowered their guard because the numbers went down so far that when wave 3 came almost a year later, I believe maybe in the fall or the spring of the next year, they weren't as well prepared, and Ferndale took a heavy hit in the Spanish flu in 1918. So I don't want to scare anybody, I don't want to make anybody fearful, but I know that people are trying to figure out, in some logical sense, what does the future look like? And none of us can really predict that very well, clearly. But what he was talking a lot about in his interview was that if we can get the other 20 or 30% who are not sheltering in place and who still don't think this is a serious matter to really double down, and I appreciate all the things that you and the health department have been doing to really get that message driven home. Thank you for that. But there are a lot of people, as we know, that still really don't take it seriously. And we have a large homeless population that, whether they do or do not take it seriously, they simply don't have a shelter to shelter in place. And so that creates a great risk as well. If we can get that tightened down, which I know is your goal and all of our goals, is to send the message here with these masks and other, this is a serious matter, and we all need everybody on board, that we will flatten the curve, we will get through this quicker with less deaths and all those things, but that ultimately it will be some sort of immunization, some sort of medicine that will come along, and that's what he was talking about, all the testing they're doing, and that within 9, 12 months, something like that, they might be ready with those vaccines to roll those things out so that it could be, a better future in that sense with COVID in particular. And that possibly within 2 or 3 months, if that curve flattens enough and lowers enough, we might be able to get back to some semblance of normal life. Probably not large gatherings like concerts or sports events, but school perhaps and other things, although summer is not school anyway. So just what kind of message do you want to be sending to the community in regards to what can we expect? How long? Where are we going? And I know you don't have a crystal ball, but
that would be so great.
Wouldn't that be nice? Or a Harry Potter wand, or any number of tools, right?
Yep. July 9th. Thank you. Okay. Yeah.
No, I know. I'm not.
No, I understand
the
too,
messaging.
The question and sort of our messaging now. And I think, you're right. There's just we're all looking at sort of models and trying to plan around dates and guests and part of the, I guess what will be important for us is we are not the first place that has sort of embarked on the increase in cases or surge as we look internationally and even within this country, looking at New York City, for example. So I believe, right now we are just constantly vigilant to see what can we learn from what's going on elsewhere. And I think watching as these places that are heavily impacted come out of it and then watch what happens in terms of are we seeing, what's the pattern of the disease over time, certainly possible. Measures that we've taken to date, we went into these measures gradually. We did not start out at the very onset with shelter in place across, the state. And I think that, what we'll be doing likely over time is as we see where this is going and we can make some solid predictions, we will lift these things sort of in reverse order to some extent. And so I think that you're right, that at some point we will not shelter in place in the way we're doing it right now. We will have to emerge from this in some fashion. And, but some of those additional measures that we like masking or avoiding large groups, remember the was one of the first things that we were doing. Schools were one of those first things. So I think we'll be looking at all of those options as we go forward. And frankly, I intend to learn a lot from everyone who's going down the path before us to see where we can go. Certainly our first lead will be the state and where our partners in the state are with their illness. In the best case scenario for us, I think, would be that as they're really entering, some of our counties in California are entering very intensive periods of caseload. If we are able to delay that up here, if we can stretch out, as you said, flatten that curve so that we are having perhaps a longer period of COVID, but we're never hitting a very high velocity of new cases, we may benefit from other areas that are coming out of their surge and able to help us respond. And you know, we've always in small rural areas been dependent on academic centers and large hospitals to assist with high-level care. I'd like that to be available to us when we need it. And so that's why I appreciate so much everybody really working on the shelter in place at a great sacrifice, I know, to really try and slow this within our own community as we watch these numbers go up. I don't want to see us going up by 5 cases a day or 10 cases a day, but I'll take that over 50 to 100 cases a day that we're seeing as in terms of an increase. What I'd like to make it is as low as we possibly can. And you're right, some people are being wonderful about abiding with all of this. Some people are not being as helpful. And I think it's really important. When I see numbers coming out of, for instance, New York, I think they announced like over 600 deaths, in like a day. I mean, they were just, this is a serious infection, not for everyone, but for a significant number of people. And we're really talking about saving lives. There is just no way around it. So.
And so we, we've always known that we should be washing our hands, but I would say we've taken it to a whole nother level. And the education around that, the videos on how to do it properly and everything. I mean, medical professionals have been doing this all along, but as a population, there's some good things there that maybe we all really needed to learn how to be better with our hygiene and all those things. And maybe we're going to never go back to shaking hands. I don't know. I mean, the whole Oriental approach is quite wonderful. But, lots of things changing our lives, definitely unprecedented.
It is, and I think we do have to go into this. Nobody wants to really think about what comes next in the sense of, 10 years from now or 5 years from now. But we have to bear in mind as we go forward that this is likely to happen in some fashion again. And we need to be prepared.
Do any of the other supervisors have any comments or questions?
I do.
Okay, Supervisor Wilson?
Yeah, this has more to do with people being able to get outside and take walks and those sorts of things. And I know that some parks and areas, mostly parking lots, have been closed down, to discourage people from congregating and really even just getting in their cars. Part of this is a reminder that for many of us who live in town, which is really most of the county live in towns, is we have many, many miles of trails. They're called sidewalks. And I encourage people using the infrastructures that they can walk to and really get to know their neighborhood in a way that maybe they haven't been doing in the past. I also want to just check in, let you guys know that I've been turning off the video because in my house we have 3 Zoom meetings happening at this very moment. A college kid who's taking a class at this moment, and I have my wife who's on a meeting for her work. So we don't have the greatest video streaming right now. But in any case, I was just kind of wondering, a question for our health officer is there any updates with regards to these closures, and do you feel like there's going to be any adjustments made to helping people to really do more in terms of getting out and exercising in their location?
Sure. Well, and I like your thought about the miles of trails we have called sidewalks. So again, going into the orders, we looked at this really carefully. I'm sure people are aware there are some areas in which the parks are completely closed. There is no access to parks. And we felt that it was important to give people this access where we are, as long as people were able to use those spaces responsibly, maintain social distancing, that we were able to have playground equipment not operational so that that was not a risk. And so I think that's been very important for us to be able to do. But it is contingent on all of us abiding by the rules that are in place about their use. I think if people are able to access the outdoors from where they live and not get in their car and travel to do that, I think that's better for a whole lot of reasons. But I understand for some people that may be difficult. I think that it is important wherever we go that we are just, again, following the 6 feet of distance, no congregate groups, not going to exercise with people who do not live in our household, so that we're not having those increased exposures, but that people should feel free to go out with their families and walk and be outside. And I think that's good for all of us, particularly as stress relief, in addition to the physical benefits.
Thank you very much, Doctor. So I have a few quick questions I'd like to ask. First of all, you noted that the commercial labs were speeding up a little bit more. I've heard of like delays of something like 12 days before people get their test results. And I know that that puts questions in people's minds as to whether or not they are effective in a way. So do you have any idea of how quick the turnaround is now with the commercial labs?
Yeah, you're right. It's been quite variable. There were times where I was hearing routinely 7 to 8 days. I've heard more recently we're seeing some in 3 to 5. Obviously, that is helpful, but because while they're waiting after people are tested, they are in isolation until we know that result. But it is obviously helpful for us to know that. But it does speak to the issue of really making sure that we have capacity in our local lab to be able to do critically important testing in terms of, again, people who are hospitalized, people who are living in congregate settings where it would be very important to know whether they're a positive case. We are able to get that result back often within 24 hours, certainly within 48 and no longer than 72. But in most of those cases, we have a very rapid time, and that is hugely important. I can't even emphasize to people how lucky we are here to have this, because there are other places in the country where hospitalized patients, it may take a week to get a result.
Yeah, I know we are extremely lucky in that regard. And a couple of other things. What about ventilators? We hear about this across the globe. And do you know if any of the 3 people hospitalized right now are using ventilators, or that far along?
Well, basically at this point, we're not commenting on particular critical care. However, ventilators are hugely important in our planning, and looking both at our baseline capacity, how we can adjust, for instance, taking operating rooms have ventilators. They're different, but they're useful. There are ways to split ventilators between patients. It's not the best scenario because it requires accommodations, but it's a tool. And then, of course, we are looking at what we anticipate we could need and asking for those to be in our area.
Yeah. Right. And finally, I think one of the issues that we have here in Humboldt County is we actually have quite a bit of senior housing and senior facilities. Are those doing okay?
In terms of our skilled nursing facilities and such? Yes, they are. And again, we've been working with them. I think they've been very diligent about working on protocols to have in place, both right now in terms of their visiting policies and those types of things and how to keep staff and patients safe, but also in terms of planning for being able to cohort patients who may have COVID at some point or are being tested for COVID so that they can keep residents safe at that time as well.
I'd like to ask Michelle if there's anything you want to add, because I know that public health has a huge task in terms of dealing with all of your clients and how that's working.
Sure. A couple thoughts that have come up in my mind as we've been talking is just I've also just been just in terms of the few folks, few maybe, that haven't been really taking the shelter in place or stretching a little bit about what that actually means. I've been hearing anecdotal stories of places like College Cove or Moonstone Beach, the parking lots being packed with cars like it's a summer day, a regular summer day. And I just really want to emphasize to folks that yes, we want to encourage people to get outside, but when you pull into the parking lot and you see that it's starting to get full, that's probably an indication to not be there. I know it's an expansive beach, but you have to cross paths with people. And so I just want to emphasize that. Sort of the other stories that I'm hearing are people going running with friends and staying 6 feet apart. Even that is risky at this point. Going horseback riding with friends is risky. You know, it's hard to maintain social distancing. You know, it is. And so it's 6 feet is 6 feet, and you might end up getting closer than you had anticipated and not realizing it. So just putting a plug for that again. It's hard. This is going to be a long time. I think the implication of flattening the curve means that we're going to be doing this for a while, and it's hard for people. And, you know, it's going to be really challenging for all of us to come summer, if we're in this for the summer, to not go to the river with our friends and just go with our household members instead. And again, find a place that you don't have to cross paths with someone if you're finding your river spot. So just putting that plug out there. And then also, I guess, one thing we haven't really touched on, and I know Connie Beck is on the call as well, we've been doing a lot of work. We assigned someone in the EOC around developing a homeless unit. And so we've got a protocol in place that's been shared with providers to get folks, homeless individuals who are being tested for COVID-19 and who need to isolate in a hotel or motel room. We've secured the Humboldt Inn for that. And we've got, I think since March, if I can remember, March 30th to April 6th, we've got 8 individuals that we've had there for 41 nights total. So over the last week, Monday to Monday. And then the other part that we're working on is working with other providers in outlying areas for other motels. There are groups that have gotten grants from Humboldt Area Foundation to also put individuals in motel rooms, and so we're partnering with them to make sure we're not duplicating efforts unnecessarily. And also identifying folks who are at higher risk, who may not be symptomatic right now, but are higher risk in that population, so 65 and older, chronic conditions type of thing. And having our service provider partners identify folks and refer so that we can get them in motels as well throughout the county. So that's really promising, I think, and a lot just in the last handful of days that's been secured. So, and then I would just say, you know, we're doing a lot, continuity of operations is a big thing, I think, across the county departments and public health as well. Our nursing home visiting, almost every single nurse that we have is deployed to respond to this incident, whether it's doing contact investigations or answering calls from healthcare providers around testing protocols. So we're doing the best we can around continuity, doing remote tele visits for families that are in our case management programs, kids and families, older adults, those folks. And then the environmental health division is continuing to function as well with staff trying to work as remotely as possible. But I think there was a question around septic tanks and how that's going. And I just want to reassure folks that things like projects around septic systems or the on-site wastewater treatment systems, we're still following up on those. We're still doing inspections and we're still documenting via scanning and things like that. So I just want to reassure folks that that's still happening.
Yeah, Supervisor Bohn.
Well, I want to thank you for mentioning, I think a lot of people stepped up and gave money recently to Humboldt Area Foundation that they were able to distribute it. And I know a lot of people have picked up for Food for People, which right on top of having a major disaster have tripled their business. And I know you've had staff down there at the food giveaways down at the old Chamber of Commerce building. Doc, you mentioned the part about skilled nursing care taking some of the patients to handle the surge from the hospitals that still need to be under care. And could you clarify that we're not taking COVID patients to the, I've had multiple phone calls that have heard that we are taking COVID patients to skilled nursing, and we're actually making room for COVID patients and moving patients that still are under a certain, we haven't started, but the availability of, which is a common practice that's been going on for years, as we well know, so.
So obviously the skilled nursing facilities hold a fragile population in terms of health. But I think what we're not talking about is being able to utilize at this time a skilled nursing facility to serve as a repository for all patients to come out of the hospital during COVID. I think the idea of this is really twofold. One is, in a nursing home setting, it is very possible because people, even when visitation is restricted, there are employees working in a place, there is a possibility that someone will become ill. And so internally, these facilities need to have the capacity to sort of quarantine patients if there's a concern while awaiting testing, to be able to retain the patient if they don't need high-level medical care in a safe way in that facility. And so that's what we're working with them on as well, is sort of how can that be structured so that that works. In terms of extra bed capacity during surge, it is possible that we would need to move patients out of the hospital who don't need high-level care into the facility, who are appropriate for that facility. And again, having that COVID piece in place in advance will help facilitate that movement. So, but frankly, at this moment, I want to keep anyone with COVID out of a skilled nursing facility as best we can.
Thank you, Doctor. And I guess, if you wouldn't mind, Michelle, to just give us a little bit of an idea of the kind of work that is happening, aside from what you mentioned in terms of finding hotel rooms and et cetera. I understand that the Department of Health and Human Services is reaching out to the homeless population, helping people understand the social distancing aspect of it, and also helping with providing food, et cetera. So can you give us an idea? I think from what I'm hearing in southern Humboldt that it's actually working very well. I just wanted to get a feel for the county-wide.
Yeah, so the home program staff in social services and DHHS, Connie's really leading that effort in terms of getting staff identified and building up that unit in order to be able to provide case management to folks who are going to be in the motel rooms, for example, that are throughout the county, regardless of what the location is. And we've produced a flyer that is based on information from the CDC and CDPH to hand out for all service providers to hand out for folks. There's the hand washing stations and porta potties that are also throughout the county that Connie Beck has really taken the lead on that. That's been really great. And food distribution, we've been hosting calls with different groups. So food insecurity is a group that we've, service providers having a call with folks in order to talk about where the gaps are, what is everybody doing, so that everybody just has situational awareness of that provides resources to folks who experience food insecurity. Same with a call for children and families and a call for older adults around those service providers. Something also worth mentioning is that for folks that provide meals to the homeless population during the day, St. Vincent de Paul, Arcata House Partnership come to mind. We're also talking with them and working with partners around a screening process. Some of them are already doing screening, but they have limited staffing capacity, and so trying to build that up in order to screen folks during high population times so that we can capture folks as fast as we can. I hope that answers your question.
No, that's great. Thank you so much, Michelle. Sheriff, did you want to add anything on in terms of any challenges the Sheriff's Department might have with regard to responses to the COVID emergency?
Testing. I guess it's on. Good morning. Thank you for having us here. Thank you, Dr. Frankovich and Michelle Stevens, for leading public health in this charge. This has been, again, unparalleled efforts on all fronts, and I think we are definitely getting through it. We're getting organized, and I think we have a very, very good plan moving forward. So, as you know, Ryan Derby is here. He's my EOC director and manager, and we have a very, very robust EOC Joint Information Center that is ever expanding based upon this this local emergency. And we are supporting public health. We're supporting our local hospitals and our local first responders and EMS, you know, for this effort. So, overall, people are adhering to the shelter in place. Our calls for service are down at the sheriff's office. We haven't seen a rise in thefts or those kind of things. We have extra patrols out 24/7, and so all in all, things are good, you know, amongst the community. We do encourage people, just like Dr. Frankovich and like the board chair said, stay at home. This is the time. This next few weeks is going to be critical, and so we need to make sure that we adhere to the shelter-in-place orders. We will be coming out with more information this week, some more clarification regarding what essential businesses are, what non-essential businesses are, to help clarify some of the confusion out in the public. And again, we're asking people to utilize our 441-5000 number for information, and we are keeping up to date on that number and questions, as well as our email. Visit the main page on Humboldt gov.org to get all the essential information and to know where to steer, you know, for all the latest information here. So,
I know also part of the EOC has a division dealing with local businesses too, for people who have concerns in that regard.
Absolutely, and if you want, I can have Ryan Derby come up and provide information regarding what we're doing as far as advanced planning, how we're reaching out to the small businesses, as well as kind of individual damage assessments that are going out regarding some of those things. So we can touch base on that. But I don't want to take up the doctor's time. If there's more questions for her, we can get to her first. But let me know how you want us to proceed.
Thank you so much, Sheriff. Thank you for reminding me about that. We do have a couple of people who have extra people who have joined us, public attendees, and I would remind you now that if you have comments or questions, you should press *9. Ryan will get that, and we'll get you on the air. So at this point, do we have any public comment? We do, so let's see how that comes. Hello?
Hi, this is Brooke Eberhardt, Deputy Clerk of the Board of Supervisors. I have a public comment that we received.
Thank you, Brooke.
Hi, one. According to the staff.
Oh, just a second.
Ken Sawatsky, item E1. According to the staff report on this item, there are many steps county officials are taking to help prevent the spread of COVID-19 and to help the community during this time, including vulnerable residents and the business community. However, it is likely that the number of confined cases in Humboldt County will increase, and staff and community partners will need to continue to take measures to prepare for issues that will face residents in the future. I agree with that statement. I would like to make the following statement. There are many steps county officials are not taking to help prevent the time to think both in and out of the box, such as our Hoopa and Yurok tribes. Speaking of which, how can we help and partner with our sovereign nations? Just about anyone can parrot state or federal OES guidelines. We need creativity and a willingness to try different solutions, learn from successes and mistakes, admit mistakes, and correct such mistakes as our airport fiasco. I disagree with staff's assertion that there is financial impact on this is not applicable. The financial impact of not addressing the issues before you with multiple emergency ordinances is nearly unlimited. Lastly, has the Brown Act been abandoned or amended? I thought the action summary of your prior special meeting was required to be on this agenda. Correct me if I've been misinformed.
And no further public comment on this item? Bring it back to the board. Any comments from Supervisor Madrone?
Thank you, Chair. Let's see, Michelle, I appreciated you talking about these large congregations. Up in Trinidad, we've been very aware of it, and as a community working to try and deal with it. The county has put up signs at various places saying beach is closed, different parking lots are closed. Those signs are being stolen, which is just amazing to me, right?
Wow, yeah.
Like up at Big Lagoon and some other places. But in talking with Sheriff Hansel, correct me if I'm wrong, Sheriff, but what you said is if you see congregations of people that are clearly not adhering to physical distancing, which I prefer that term, physical distancing. Right. You know, everything's being modified slowly as we go through this process. But to call the sheriff through the dispatch and to report it, and they will do their best to try and go and talk with those people and get them to break up. So is that, you think that's the best response there for that?
Yes, Supervisor Madrone, it is. That's the goal of this is that the social distancing.
Yep.
And so if you see people congregating, absolutely give us a call,
Yep.
and we can come out there if calls for service warranted and separate them as much as we can.
Great, thank you. So I wanted to thank you for bringing that up, and thank you, Sheriff, for that response. And then on the septic, yeah, I've had some calls from people that were right in the middle of a project. The office is closed, so they just call and leave a message, and then somebody will get back to them on their septic project.
Right.
Okay.
Yeah.
Great.
I didn't.
That's DEH, I know. So.
Yeah, yeah.
They're underneath public health, right?
Yeah, they're under the public health branch, right?
Yeah,
yep.
Great.
I did want to also mention, because I didn't speak to this about environmental health, but you know, when we were in the PSPS event, we all remember that, they did some targeted outreach to businesses around food safety, and there was some negative feedback around that. It apparently worried people or made them feel otherwise, that they shouldn't have been doing that. And so we did some targeted outreach this time with this in terms of notifying folks about what the orders were that were coming from this state and then us locally. And that also had some folks calling you all to complain about that, and so we stopped. And now we're getting criticism and feedback that we haven't been calling and haven't been doing the outreach that we did during the PSPS event. So we're trying to get it right. And I just want to say that we have since started to do outreach. Environmental health staff have done outreach to especially folks who provide meals for homeless individuals or anybody else that's at risk or part of a vulnerable population. And those are permitted facilities that environmental health does have oversight over, and non-permitted facilities because they don't have anybody to go to necessarily to ask questions around food safety and how to administer or implement strategies to prevent transmission of COVID-19 while they're still serving the population. So we are doing those things as well. They've got a long list of folks that they've been doing outreach to that they actually don't have any purview over because they're not permitted facilities, but I'm hearing that that's appreciated. So wanted to let you know that as well.
That's great. And one last thing that I had was, in the Trinity Valley, there is one laundromat. It's in Willow Creek, and it's closing in the next week. And that, to me, is a public health emergency. I mean, if people that don't have their own washing machines, don't have a way to do their laundry, that becomes a very big, risky situation for a lot of people. So I've been working with Humboldt Area Foundation. I think we've put Connie Beck in the loop on this, but we're trying to figure out a way to keep that laundromat open, at least for the interim, while this crisis is in place. I just wanted to let you know about that. We're not quite sure what's going to happen. We're, community members are possibly stepping up, but it's something that I just wanted to put on your radar, that one laundromat in the whole Trinity Valley, that's a pretty serious situation, really. So.
Yeah, definitely. Well, okay. Thank you. I wasn't aware.
Yeah,
thanks.
Thank you.
Thank you very, very much. I really appreciate all of the work that you both, or well, everybody is doing. And I just want to ask you, Doctor, is there anything else that came to mind before we?
No, just really, thanks to the board, and really this has created an amazing array of partnerships. Mm-hmm. We're working, public health is working very closely with law enforcement, fire, EMS, hospitals, skilled nursing facilities, just schools, a wide variety of partners through this. And honestly, the response could not could not happen with that partnership. So, you know, we just appreciate it deeply.
Thank you very much, Doctor. Appreciate you and your work. And we'll let you get back to that. And we'll be looking for the next Humboldt Alert, Health Alert this evening on HumboldtGov.org. Thank you so much. Thank you. So I'll bring Ryan up, if you wouldn't mind. Ryan Derby is Director of the Emergency Operations Center, and you might have some details for us on issues that you're handling.
Yes, so I think Dr. Frankovich, Michelle, and the sheriff hit on most of what I had to talk about, but in the EOC, we're doing a switch in our operational objectives this week. We're going to be expanding our operations section to include a surge branch. Up until now, they've been in an advanced planning unit, and I think now with the climbing case count, it's time to move them into operations, start planning for alternate care site locations, fatality contingencies, and those types of things. So what that does for us is just increases our structure, brings more people into the fold, and lets us start planning for 2-3 weeks, a month out. Everything in the operations center is looking towards the next operational period. So the work that we're doing today is for the operation tomorrow. And I want to thank Public Health for giving us some of their specialists to make this happen. We have Dr. Ennis, who's going to be the director of our surge branch, and working with local agencies to fill in that network underneath him. So our priorities right now is continued support for logistics and commodities as required throughout the operational area, the boundary of Humboldt County. Supporting public health in any way necessary. It's kind of a point of pride for me that this operations center is filled with medical personnel, public health, and just allied agencies from throughout the county. It's not just the sheriff's office, it's not just OES, it's everybody. So I want to thank every agency that's helping with this. Today we had Arcata PD lend us their command van so we can expand out into the parking lot a little bit. The support is just overwhelming. That's all I have. Thank you.
Thank you very much, Ryan, and thank you so much for being such a steady hand on this unprecedented response to an unprecedented epidemic. Thank you.
Thank you.
So with that, if there are no further questions or comments from the board, we'll go on to our next item, which is basically going back.
Excuse me, Madam Chair.
Yes.
Were we going to have any presentation from DHHS? I know Connie was on the line or not. I had some other concerns and questions that I wanted to raise in regards to the homeless plan before we go to the next agenda item. If you remember, we talked about this. You said this was the appropriate place to bring these issues up at.
Yeah, we have two items coming up right now. One is adopting a local residential eviction ordinance, and the other is a postponement of standard penalty waiver procedures for late payment of property taxes. Did you think that?
Well, before we go there, no, this wouldn't fit into either of those items. You said that I should bring this up under this item on the COVID update.
Yeah, okay, so you have another item under...
I had some questions about our homeless plan, and I want to start out by just saying, first of all, that I appreciate the incredible work that everybody's doing, and I know Connie's been personally really putting herself out there to generate some toilets and some hand washing stations and some other elements. Project Room Key seems fantastic. But when I look at all of this, and again, none of this is meant to disparage any efforts on anybody's part. I've just been thinking a lot and had a lot of responses from constituents in regards to the other 90% of the homeless population. So those that test positive or are being tested might get a room key. And then there was also the hope of putting the vulnerable over 65, as well as those that might be immune compromised, ultimately in those situations too. And there had been screening that had started to figure out who those individuals were, but in this report I got from Connie, it talks about how most of them won't come in to get tested or screened and put in a room key situation because they have a substance use disorder or other kinds of issues that make it difficult for them to be in that situation. And so it just seemed to me that, I don't know, just rough numbers, you know, maybe 80–90% of the homeless population will not be getting into Project Room Key. So they're still out there. And when we look at what the current situation is, it's a bunch of camps all over, or people camping in business entryways in Eureka along 4th and 5th Street, or in the woods or the marshes. But basically in completely unsanitary conditions, right? So it seems to me that as that population becomes infected, which will happen, there's a great risk of surge just out of that population alone, which could really overwhelm our already overwhelmed surge capacity from just standard stuff. So I'm trying to figure out, as a board member, what can we do as a board to set some policies in place to assist the sheriff, to assist public health, to assist DHHS in dealing with what I think is a really bad situation. The current situation, as I said, is unsanitary. So if we were to create safe parking lots for people to park, those that have cars, to safely park in a parking lot, and there were sanitation facilities around that, that would be a pretty straightforward deal. It's more complicated if we create tent camps. I realize that. But even if we were to have these camps, if we were to create safe parking lots, if we as a board were to set a policy that said, we're going to allow the agencies, the Sheriff's Department and DHHS and mental health to figure out, or public health, to figure out what sort of other facilities might we provide for the homeless population, be it safe parking lots, sanctuary camps, or other kinds of situations where we could bring sanitation facilities, toilets, hand washing stations. And I realize we don't have the money to person these places, right? That's the big barrier is, well, how do we fund that, right? Well, right now, all of these camps are self-regulated, right? So they're currently self-regulated, and they're on private property for the most part, which we don't really have the right as a board to say, go ahead and stay there. We don't have that right in any way. So wouldn't it be a better situation to open up some parking lots and other facilities and allow them to self-regulate, but bring in sanitation facilities, provide visitation by deputies, DHHS, and the NGOs who are saying they're willing to step up and help? I've got that in writing from many of them. Wouldn't it be better to have them in a sanitary or semi-sanitary situation where we can control this a little bit better than to still continue to have the bulk of the population out in the woods, in the marshes, completely in unsanitary conditions, but still wandering around the community, you know, potentially spreading and risking an increased surge. So I've been struggling with this, and I know all of you are. I know, you know, the sheriff and Connie and others have been really struggling trying to figure this out. So I'm not trying to tell you what to do, but I believe as a board what we can do is set policy, like say, we're going to allow for certain things to happen in certain places. Then working with our partners, figuring out how that works. And as I said to the congressman this morning, I think we need more resources to be able to help person those places so they don't get out of hand. And again, this would be temporary, just during the shelter-in-place ordinance, that kind of thing. So I'm just curious, you know, what your thoughts on that. It just seems to me the current situation is very untenable, and I'm trying to figure out a solution.
I'm sure Connie has some comments to say, but first I would just say from a public health perspective, I don't believe that setting up any type of space like parking lots would actually be beneficial. And let me tell you why. I'm hearing anecdotally that around the Eureka area in particular, there aren't very many camps with more than 10 people that have congregated. If we have a parking lot, for example, available for folks, that would increase that number. And the very numbers of that and self-regulating would be really difficult, I think, just because 6 foot distance, you know, is not something that as a people that we're used to having to do. And so from a public health perspective, I would be worried about that in terms of it actually increasing the likelihood of transmission if you have spaces for people to stay.
But again, if you were to have enough of them and had some guidance, you know, 10 people, per site. I know it's not easy, but right now they are self-regulating out in the woods, you know. So I understand your concern. You don't want to create one space where everybody suddenly comes. That's why I think there ought to be spaces in every community so that it could be dispersed and not create that congregation. So, I mean, any issue that's brought up of why we can't, I think we can kind of, instead of stopping there, look at that and go, okay, we don't want to have too many congregate in one place. How do we deal with that? You know, so that we continue to try and look at measures we might take to be able to do something better than what's currently going on, which is completely unregulated, you know, and pretty risky situation out there for the larger community. I mean, in many cases, these are many of the people you still see wandering around.
Supervisor
People that don't
Bass?
have a shelter.
Sorry.
Thank you. Thank you, Madam Chair. That was a long question. I was still waiting for the question, but I get the gist of it, and I wanted to cut to the chase and ask Dr. Frankovich. I've heard the same things about the smaller encampments are actually better for not having the spread. At least that's kind of anecdotal. Is there any agency, anyone that's so far come up with best practices? I think CSAC's working on it, but I'm curious if there's, you know, there's so many different views on this, and I understand where Supervisor Madrone is coming from, but it's also, you know, the question's in the air. So I just wanted to throw that out there that I don't, I've heard more of what Dr. Frankovich was saying versus what Supervisor Madrone was mentioning. So I just wanted to chime in with that.
Yeah, I think it is. I mean, obviously, both sides of that are correct in the sense that, you know, it's a big picture to try and address. The whole idea, of course, with the distancing measures are that the reason we tell people they can only be outside even recreating is with their own family unit is because you don't want disparate groups of people coming together who wouldn't normally be together. And so there is a little bit of a protective quality in people assembling in small continuous groups that are like a family as opposed to assembling in large areas together using common facilities, that type of thing. That's not to say that there aren't things that we can do to address that, and I think the work that's going on between sort of the NGOs and DHHS and trying to just explore the very thing you mentioned, which is what are people finding works? We can create motel room space, for instance, but if people are not willing to stay in that, who are asymptomatic individuals, we can't force them to do so. And so we have to find a solution that actually works on both sides, that people can, who are homeless are willing to participate in, and that we can actually structure safely to do so. So I can't tell you I have an answer to that problem. I think communities across the country are struggling with this. And I think the inroads we've made, at least trying to assess people who are symptomatic, get them tested, get them lodging, trying to keep them safe and fed while we're trying to make sure that either they're negative or continuing to do that till they're no longer infectious is a good first start. But the larger issue at hand, I agree. It's everyone, I think, from the gate has sort of seen this as a potential for, as you mentioned, Supervisor Madrone, you know, upping the ante on surge activities. So all I can tell you is that a lot of people who work with the populations all the time are putting a lot of thought and effort into trying to figure out what might work on all sides.
So I'd like to chime in here a little bit because I have been in contact with some of the NGOs that you referenced. And we need to remember, we talk a lot about the homeless as if the homeless can't hear. And
that it's a single type of person.
Exactly. And I believe that we all in Humboldt County are aware that social distancing is very important. And I know from the NGOs, from those in the houseless community, that is of great concern to them too. And I know that some are providing things like extra tents, extra areas so that they can set up encampments if they don't want to live in a motel. They can set up encampments that are spread out from each other. So we have to remember that I think the most important thing from my perspective anyhow is that they are aware, people who are not, let's say, tuned in, although a lot of houseless people nowadays will have a mobile phone, but, you know, get that message out there, the best practices, and help people as best we can. And I do think it's difficult for people who are working with the public health department to put themselves in situations where they've got to climb down ravines and all of that. But I know people have been doing it. And so I actually like to ask Director Beck if you could give us a little perspective on how your efforts are going, because I know you've been working on this night and day.
Yeah, thank you so much. I just want to mention that we are following the state of California's recommended protocol for people who are experiencing homelessness. That's what we've been working with for the last couple of weeks. So that includes folks that in medical care, in a shelter, or unsheltered. So as you know, we secured the 14 rooms like we were talking about. We've secured additional rooms. We are doing screening at, well, we just started doing the screening at places where people come to get meals, free meal and Arcade House Partnership. We have a criteria that folks are screening that have people in shelters. So they are doing the social distancing. They've moved, their cots, the proper distances. They are doing all of those appropriate things. And then for people that are unsheltered, it is the recommended guidance that we don't congregate folks, and especially more than a few people at a time. So there are some places that are talking about moving a few people at a time. But at this point, I think it's a bad idea to move people from where they are. We have put in an order for new sleeping bags and tents for folks. We did the hand washing stations and porta potties, so it was cleaner. Our community partners are placing those in areas where the homeless population tend to be more often. That doesn't mean that it's at every camp, but it is in a location where they can find. A lot of folks that didn't have shelter previously had been using businesses that were open, and since businesses have closed, that's one of the reasons for the washing stations and the porta potties. And public health had created a brochure for people that don't have phones or internet, and ways to figure out other ways to find out about COVID. We actually have brochures that people are handing out. The homeless population is more isolated, and maybe safer in some instances, or I can only hope. I know this isn't all perfect, but we are working on strategies and have weekly calls with partners, and taking their ideas also about where in the communities we can locate. One of the things that I've suggested is that we provide garbage bags for folks to clean their own garbage, and maybe volunteers go and pick them up so that we're not distributing that kind of stuff. So I do think law enforcement has agreed to not have people moved from place to place unless there's illegal activities. I think that's helpful. I do agree with Supervisor Madrone. If they're on private property, it's not like we can say, yeah, go ahead and stay there. But if they're there, we're not asking them to leave.
So jumping off of that a little bit, is there anything that we as supervisors can do in terms of policies that would make your job easier?
At this point, I don't have any recommendations for a policy.
Okay. So, well, that I think is the thing that we need to all be aware of, is that we are a team. Whatever our role is that we play in that team, we're in it together. And so, of course, we would be very much willing to work with you depending on what you decide might be a good way to go. But I do think, I guess one of the most important things is that people, there are certain categories of why people are homeless. Some people are addicted, some people are have mental problems, and some people are just down on their luck. And I think probably the people with addiction and or mental problems are going to be the most difficult to interface with in terms of understanding what's in their best interest. And I don't know that we are hopefully going to ever have to get draconian about that, but at some point that might have to be the case. And at this point we're recognizing people's rights to make a decision about how they isolate themselves. Supervisor Bohn.
Knowing how much that Connie Beck and her team has worked with our community partners to accommodate rooms, and been watching this for years upon years upon years, I really truly believe if somebody wants help, they want a room, they need help, we will provide it. It's now, we're at that point now of trying to help people, and this is where we get to the 60 to 75% that have mental health issues according to all things. Now we have to convince these people that they want help. And so the people, I think the people have to understand, the people that are on the verge of just getting into homeless, that want to get out, that want to help themselves, our community partners with Betty, the rescue mission, and especially our DHHS team who works with them all, is hitting that nail on the head 100%. They're getting help for these people with all their teams. I mean, look at all the assistance we give the city of Eureka for Uplift, MIST, their CSAT, all those teams that we're helping with our Measures E and other funding. So I applaud that. We have the same problem that that all the other counties have in the state, and a lot of places in them, except maybe Alpine County with snow on the ground, is having with the same issue, is getting that part of the population. And it's as simple as it's hard to help someone that doesn't want to be helped. And that's the hurdle we have to come over. And I appreciate staff hitting that hurdle on every day. And I know it's probably the most frustrating part of their day because we all see it every day. We walk it every day. So they know that we're aware of it. Calls about it too. So thank you guys.
Supervisor Madrone.
Thank you. I appreciate the hard work that everybody's doing, and I know that there's not a day that can go with this issue along with so many others. I think that if we don't get out in front and figure out how to do this, they're going to be doing it on their own, and the evidence of that is already evident in Arcata. At the community center parking lot, people are congregating there. They're coming in and starting to camp, and the city's trying to figure out that one. I hear there's issues at the library parking lot here in Eureka. It's easier for me to think about it at my district level, and McKinleyville being my largest community. What, 50, 100? It wouldn't be that hard to figure out how to create safe spaces in parking lots to segregate 50 to 100 people in several different parking lots, in small groups, perhaps the groups that they're already congregated in, ideally, so you're not mixing them and stuff. So I think we're either going to figure this out and set a policy that allows our departments to proceed, or we're not, and they're going to self-do it on their own. They're going to be moving out of the woods and moving to where they feel safer, and can get assistance. And with the Boise decision, I mean, frankly, they have every right to camp on public space right now. So it's a difficult one, and I'm not trying to put a burden on anybody. I'm frustrated as a board member in that there's so little that I can do. Well, the one thing I can do, as the sheriff has said over and over, is communicate with my constituents, and we're doing that, all of us as board members. That's really what we're doing every day, 12 hours or more a day. But the other thing we can do is set policy. You know, that's our primary role. And so if it would be advantageous now, today, or as soon as possible to set a policy that says we're going to allow for the use of county spaces, certain parking lots, maybe we identify where they are in each district, for the use of whatever needs become evident as this unfolds. Then we've taken that step in advance. That's called planning, rather than being reactionary. And we don't do that planning now. We don't set that policy in place, and then it becomes an emergency. We suddenly are trying to react, you know, in a short period of time. So by setting that policy, it doesn't mean we're going to do that. It just creates the space for the sheriff, for DHHS and others to think about, are there certain things in certain communities that we might be able to do that might help, you know, prevent a further surge and other things. So that's really where I'm coming from, is trying to figure out what I can do, what we as a board can do. So perhaps what I could do is make a motion to direct staff to come back to us with a draft policy that might allow for these kinds of things to occur on parking lots and other surplus county property. Just so that we can get ahead of that at our very next meeting, because I realize it's not agendized really to take an action today. We're here to discuss. But I would suggest, and I would make that motion, that we go ahead and direct staff to work with our department heads and the sheriff to figure out what kind of a policy could we put in place that would allow for this option to exist in a timely manner. It's called planning. So I would make that motion.
Supervisor Wilson?
I have a question for the motion maker. Yeah, I have a question. Or actually, it's really for Connie. So Connie, what's being asked by Supervisor Madrone is there a policy needed for you guys to be thinking about these assets that the county has in your response planning? Because I'm not so sure that, I guess, that these assets that he's talking about, whether it be parks and other things, these are not off the table currently, right? I mean, these are all part of what you guys are considering in terms of moving forward with planning and your response. So I'm just kind of wondering, are these things off the table, and do you need a policy to put them on the table in terms of your discussions and your strategic planning processes?
So I guess if we were going to use a space, a county-owned space for something like this, maybe you would want a policy. But at this point, that's not something that we're looking at. I'm not saying that we might not get there, but at this point, that is not a recommendation for protocols around homelessness and COVID. So maybe Amy or someone else would be better to say whether we need a policy for that or not. I'm certain that all board members would want to know if we were using a county space for that.
Just for clarification, I'm just asking, like, are any of those things off the table now? I mean, do you need a policy to then add them to the suite of options that you're looking at currently? And I, on a side note, I will say the hummingbirds in your background, very nice, very, very cute. You're like that a lot. But I'm just wondering, so are you, you know, I understand that you guys are currently, you don't have them on the table because you have considered them, because you, as far as I understand the conversation that I'm hearing, is that, you know, the policy of congregating people in county parks or other assets is a concern, that you might be actually aggregating people. It's similarly in a way that we're trying to discourage people from recreating in these aggregated areas. It's for similar reasons to concentrate people experiencing homelessness also in these areas. It seems to me you are considering these as potential options, but at this time have not chosen to. And I'm just wondering how a policy would change that or not change that.
So I was thinking along those lines myself, Supervisor Wilson, CA also want to invite the sheriff and to discuss that as well. Amy.
So I would just like to add that the EOC has a logistics section, and they also have somebody who's working on homeless services. And so those county properties that Supervisor Madrone spoke about, all of that would be explored under and through the Emergency Operations Center. So I don't think at this point in time a county policy is necessary, because we have a local emergency declared, a statewide local emergency declared, and so we have the policy direction at our fingertips now that allows us to explore all the avenues that we can in order to address the health and safety concerns of this community. So I hope that helps answer the question.
Yeah, that was exactly where I was going, so actually I would like the sheriff to talk to that too, please.
Absolutely. So the Emergency Operations Center is established, does establish a homelessness branch of that center. The one thing that I want to stress here is that we have to prioritize right now, and our #1 priority is the over 65 and vulnerable population of the homeless, and those that have been tested and need to be quarantined, and those that maybe be tested and become positive, put into isolation. So those are our plans right now. There's a lot to plan for in those circumstances. The places have it in quarantine, as well as the transportation aspect from the medical facility to this place, and then also keeping an eye on the people to make sure they don't leave. And so once we get a handle on those processes, and then I look to the direction of our homeless operations to see what are the next steps. And so the next steps could be, okay, now we're in a place where we can bring homeless from the outlying areas, give them an opportunity to camp. Because I know, talking with Connie, you know, as part of our overall homeless strategy to create a camp, something like that. But right now, we have to do these in small steps to make sure that we don't get overwhelmed, and make sure that we house those vulnerable population first, then move beyond that. And so it is part of that future planning, and then looking at government space first is always a priority, always has to be, and then we move out from there to look at private or other spaces.
Well, I can certainly appreciate all that effort through the chair, excuse me.
Yes, go ahead.
But clearly, the people even in Project Room Key are not going to be supervised 24/7. On some level, they're going to be self-regulating, staying in those motel rooms, right? There's nobody going to be there 24/7 keeping an eye on them. So, I mean, that's not a whole lot different than what I suggested with camps, because to think that because you have Project Room Key, suddenly everything's locked down, everybody's staying in one place, it's just not true. It's self-regulating to a large degree with your oversight. So I appreciate the discussion, and I'm not going to push it any further. I do think it's part of good planning, and if, as Amy says, we already really have that authority, I think that's fantastic. I see Michelle nodding her head. So I just want to keep that on the table, and I do know that there are a number of public members that are waiting to speak to this as well. So thank you very much, all of you, for your input. Well, we need to tell them.
If I could just add one
not
comment.
On this item.
Okay, guys, thank you. Michelle, please. And then I'll go to Supervisor Bass.
As Connie referenced, that we're following the state's guidelines right now, this is exactly what the governor initiated when he made his executive order and identified those that are experiencing homelessness as a vulnerable population, and exactly why the state is actually engaging in lease agreements with different hotels and motels across the state, which is exactly what we're doing here. So we rely heavily on what the CDC and CDPH is telling us in terms of what their guidance is and data-informed guidance. We have calls with the state, the Dr. Angel, director of California Department of Public Health, and her deputy twice a week. Local health department, public health directors, and health officers do, where we are informing them of what we're experiencing on the ground. we have these conversations as a group together with them, and we're informing them, which then gets to the governor. So I feel pretty confident that as a state, everything is on the table when it comes to this population. Right now, this is what the governor's initiating, and this is what local jurisdictions are doing as well. My colleagues are doing the exact same thing in terms of locating hotel rooms and engaging in lease agreements. So if that changes, and when that needs to change, we will be looking at anything and everything. So I don't think we need a policy in order to do that. It's just my final comment.
Thank you.
Yeah, and I will remind my colleagues that we're under the incident command system. It's very well structured, and every day that we're out here doing our share, all of the members of the OOC are working feverishly and planning, and have all of the tools that we have at their disposal. And I would think that if they need a policy, we would hear very quickly from them. Supervisor Bass, sorry to keep you waiting there.
That's fine. Yeah, I was just basically, I wasn't supportive of the motion, and I don't think it got seconded anyway. But you know, I appreciate, obviously, Supervisor Madrone has a lot of passion about this, because this has been a long conversation. Good, but I think we can safely, I feel very comfortable that we leave it to OES. They're more the experts. We all know that one supervisor cannot drive the bus. And so I appreciate that the conversation is here, but I think that I trust the team that we have, that if this seems like it would be workable, they could move in that direction without a policy. So that's all.
An extra policy. The policy is to do everything we need to do in order to respond to this pandemic. And I want to thank everybody. I especially want to thank Dr. Frankovich and Director Stevens for hanging in there. I was trying to cut you loose. Thank you very much. And thank you very much, Supervisor Madrone, for bringing that item up. So with that, sorry. I thought we did public comment on this item already.
I would just remind the public that that we have participants in the attendee queue, you need to push *9 on your dial pad to raise your hand, and then we can call on you. So if you have comments, *9.
Thank you, but we did already take comment on this item, so we're going to go to the next item here right now, and this one is matters initiated by board members. This first one here is consider adopting a local residential eviction ordinance, and that comes to us from Supervisor Madrone.
Thank you, Chair, and members of the board and the public. So I appreciate that the, where's my notes here? There we go. I appreciate that the governor passed the executive order that provides local jurisdictions the authority to adopt more restrictive COVID-related eviction measures. But I wanted to encourage my colleagues in the county to look beyond the governor's order and adopt an ordinance that protects all tenants and landlords affected by the pandemic. It's vital to the entire community and our health that residents are supported and staying housed during this challenging time. City of Eureka took this up the other day. They passed a more restrictive ordinance, very similar, if not identical, to the one that is in your packets, an example ordinance provided to us by Legal Services of Northern California. And so I brought this forward because from all the research that I've been doing and other information, it seems that we could do better than the governor's order in providing clarity and protection to not only tenants but also landlords, so that it's perfectly clear to all entities how that might work. So that's the reason that I brought this forward. You have in your packet a template for an urgency ordinance that includes findings and purpose that shows that we do have the authority to do this. It talks about an urgent need to be able to do this and provide clarity, because the governor's ordinance only covers certain tenants and doesn't really provide the clarity to landlords that I think is deserving. It's got some prohibited conduct in here, noticing to tenants that needs to occur, as well as definitions. It's, from my perspective, a well laid out sample ordinance. And there are some subject matter experts that are prepared to talk to this, I believe, on the line as well, from legal services, as well as other members of the community. And so with that, I'll just introduce the item and see what kind of questions, discussion the board might have, and or other people want to participate on the line. Thank you, Chair.
Thank you, Supervisor Madrone. I'll ask the board members first, and then we'll go to people waiting to speak. Supervisor Bohn.
Where do you see the experts? I'm not getting it on my screen. The experts waiting. Okay, all right. Well, I keep hearing about did we talk to some landlords on this? Because I sure got a call from a lot of them. And I talked to one who's probably one of the bigger ones, and he's only had 2 evictions in the last 5 years. And I just had questions why we're going all the way back to January 1st, retroactive all the way to January 1st in urgent need. I didn't quite understand that one. And number 2, I mean, we didn't even go into our emergency ordinance, our urgency ordinance till March. That one had me a little confused. Delayed payments, not limited to, but limited to a payment made late. And that's under section 5 definitions. And then down there it says, to provide documentation to support the claim within 7 to 10 days of, it sounds like they can just text their landlord and say they can't pay it, if that's all the availability they have to get a hold of them. And then I want to know if this has gone through county council.
It has, and in your packet there was a couple of page letter that was sent from legal services to county council, but there is no response from county council included here.
Well, that's what I'm saying. So is county council's aware of it? Have they responded to this?
I assume that they would be here today on the agenda item to be able to respond, so they're online and ready to provide that feedback, I assume.
Okay.
Good questions.
And then it says, Section 8, the county shall establish a fund with the core service agency to be made available to rental property owners with demonstrated hardship related to the inability to enforce demand for non-payment of rent. We have, this lines up with free bus service, with everything free. I think we're gonna, if we come out of this 75% whole out of this COVID thing, and with that many businesses, I don't know if we're gonna have money to, I don't know where that money is gonna come from. And I know Eureka brought this forward, but aren't they readjusting theirs too, from what I understand? It hasn't been adopted, they read it in, and now they're making some changes. Did I read that right? So I think I think we should probably have a more robust discussion from both sides rather than just legal services, and probably get some more input from landlords, because I think we've got 180 days in here. I mean, and the problem being is this is for people that are lost their jobs during COVID. Right. Well, even a person on minimum wage who's going to get $200 a week for unemployment, who was making $300 a week, he's going to be now getting $800 a week because he's going to get that $600 check. So this documentation, is there going to be enough documentation saying, well, are you getting this, this, and this? Or just saying, I lost my job, I can't do it, knowing that they're actually, I mean, that's a big problem with a lot of people that have cut back workforces. Once that $600 check comes, some people are thinking they'd be better off on unemployment than they are actually working. So I think the breakdown on this is, I think where the idea is pretty good, and I think it's great if there's a problem.
Right.
But the issue being right now, and I've talked to quite a few landlords, most of them are going to work with all of their tenants because that's where they make their money, and none of them are at 100%. So they're not going to evict somebody thinking there's somebody in line because they don't have somebody to take that. So the promise of somebody that's already in there, a known quality who's making a commitment to them personally, rather than bringing a hammer down on them. I just don't know if this is, I mean, I'm glad for Eureka, I'm glad they did this and everything else, but I think until we get some input from, I know the Humboldt Association of Realtors, that's just one. I've got quite a few other people that have called in, but I have quite a few small landlords who, the average is around 50 to 60% of that rent payment covers their payment. And they don't all have HUD loans. They're all getting an extension. Some are getting extensions, some aren't. Some are personal hard money loans that they just went out on a limb and bought them. So I appreciate legal services and all their input saying that what we wrote is great, but I'd like to see input from a few other people on this. And like I said, I didn't get this till yesterday.
Well, I think that brings up a point that I'd like to make. This is an emergency meeting. We did agree that anytime we met, we would put items on the agenda. However, our agenda doesn't have anything of the documentation that Supervisor Bohn is referencing right now. So for the public at large, there is nothing. And that's because I was getting some of those emails last night at 7 o'clock. And so if anything, I think this is something that we're going to have to bring back at a later date. But I would like to ask Council Billingsley, who's on the line, to respond to some of the concerns that were brought up with regard to your review of this document.
Yes, thank you, Chair. My office has reviewed the proposed ordinance, and if there is policy direction from this board that they're interested in such an ordinance, we could draft something that would be the most defensible. Without going into details, I would not recommend adopting wholesale what was recommended, but if there is a policy direction, my office will draft what would be the most defensible action way forward for the county.
Thank you. I did want to say that, first of all, I appreciate that the governor has taken this step, and it is already something in place to protect people from being evicted at this time. And it is a hardship. Everybody's got a hardship right now, including the property owners who rely on that income. Some people, that's all they have for income. So we have to keep the impact on everybody on mind. Supervisor Bass, did you want to say something? I saw you kind of looking animated there.
I think Supervisor Bohn hit some of the concerns that I had. I mean, I had talked to legal services. I think they do wonderful work. I have them. They've helped a lot of people that I've sent there. And so I think there's good intent in this. I'm uncomfortable, now I'm wondering, did the city of Eureka tweak theirs a bit? I feel like I don't really know enough. I can't understand the January 1st date either, because that implies that someone who perhaps is already in the process will then have it extended, and it's just not sure how that works. Also, it talks about protections for the landlords, but when you read it, it's one, it's not very clear what that would really look like. But if they have to wait till they don't get payment and they keep fighting to get payment, what point do we step in? It says in here, before foreclosure for the landlord. It's like, that's not good enough, that's a problem for me. So, whether it could be worth further conversation, I'm definitely glad the governor made the first step, and it's kind of like, how do we tweak it from there? Thank you.
Thank you. I believe Supervisor Wilson also has, yes, Supervisor Wilson.
Thank you, Madam Chair. I would say that I, in generally, favor that we as a county consider adopting something in this realm. I want to say that I do think that some of the issues that Supervisor Bohn and Bass have brought up are valid, and some I think maybe need more addressing in terms of just responses. And I would be in favor of having our legal staff review what's there and then bring us back something. I think it's worth looking at. Part of the reason is, and I understand where Supervisor Bohn is asking the question about, like, well, how often do evictions happen and those sorts of things, but we're under a high stress situation currently, and I think these are one of the ways that we can help people feel assured that there are protections, and I think that this is not unreasonable. I don't know where the city of Eureka is at in terms of theirs. I know that they had a discussion about it. Certainly, if they are going to come back with revisions, maybe our legal counsel could talk to theirs and see what those might have been. I did get a concerned constituent ask about, well, what about properties that, where people are doing illegal things, or, that evictions would already be kind of the normal course, and that even sometimes it's even hard to evict tenants that can be quite destructive to properties and neighborhoods, and how would this impact that? And I think the language in this addresses that, and basically saying that under other normal circumstances where evictions might occur, that this just wouldn't apply. And so I thought that was pretty good. And I myself am a property owner with tenant, and we're having to work things out for sure. And having read through this, I don't feel like, personally, I have much of a fear, but I can understand certainly concerns, and certainly the tie between people's ability to generate a living through, they're basically the service of providing places for people to live and do business, and those can be challenging even in good times for some, and this is one of those times where it's even more so. But in this case, I would be in favor of asking staff to come back with something that addresses the questions of the other supervisors, and see where we might go from there. That's just my 2 cents for now. But I'd like to hear from the public as well on this.
Supervisor Bohn?
And as we write this and as we get input, I think it's so important, as Supervisor Fennell said, that everybody has reassurances across the board during these financial times, and fully understand somebody that's renting and somebody that's depending on that income from the renter. So I think we have a lot of input from renters and people that are advocating for them, bringing a lot of stuff forward. And I hear that this is for landlords too. I just haven't been able to talk to any landlords that were contacted in the writing of this, and the ones that I've talked to, and then I've reached out to a couple, they didn't feel it wasn't as quite the savior for them as it's, this is for renters and landlords. I know this says it a couple times in here, but they didn't quite see it that way with the extra language in there. So I think the input from all of the spectrum of people involved makes for a better bill or a change or whatever. They were all willing to work with the governors. I know the one thing is they said the 180 days was unworkable financially. I mean, that was, that was, like they all said, if they haven't started to make an effort before then, it's just not going to be there after that. Even the bank and the forbearances that are coming through are not going to be anywhere near 180 days. And especially with, as they all said, if it is job related, on the books job related, they're going to be pretty much made even by the $600 check and their unemployment, at least for the next 4 months. So they were trying to figure out a distinction. Would they be able to get their unemployment records and things like that? They weren't sure. So I think there's a lot of questions from the landlords out there that need it. And the renters, you know, I imagine there are questions for them, and we want to make sure they're reassured. And I think our state system and our system, we have reassurances for financial assistance for some of those people. So there's a lot of, if you call the helpline, I think there's a lot of avenues to go through. So I know it's always good to get another rule on the books, but take one off and I'll put one on.
So let me go now to public comment on this item. And I will just remind you that you press *9, and that will let us know that you're ready to address the board. Oh, excuse me, just one moment. We actually have Sheriff Hansel. Thank you so much.
No problem. I'd like to, make a comment here about the evictions in general. Number one, the sheriff's office is the one that carries out evictions within the county. There is a provision within the state law that says during the time of an emergency that the sheriff can suspend evictions in the county. And so I've already done that. I've already suspended evictions. So we're not serving evictions at this time. The courts now have already, our local court has made the determination that they're not even receiving any paperwork on unlawful detainers, which is the court process to evict someone, and that currently isn't going on right now. They're going to relook at things on April 16th. That's our local court, but actually the Judicial Council is meeting today to suspend all unlawful detainers. And then push those out. If they get filed, they push them out at least 60 days, okay? And then once unlawful detainer, the court process takes at least 60 days to go through, okay? So we have to have a court that's willing to process this paperwork and get this done. Right now, we don't. All indications are that the Judicial Council will vote to suspend those, and then our court will follow suit. So they can't even file something 60 days from now. And I assume that will continue 60 days after that, because I'm sure that we're not going to be back to normal, but we'll wait and see. So I think the spirit of what the board is wanting, the spirit of what Arcata and City of Eureka have done is good, in the spirit of things. But is it necessary at this time? If someone wanted to evict someone, they can't do it in the county of Humboldt. Okay, so just so we know.
I will echo what you're saying, Sheriff, because I actually was contacted by somebody who's concerned about their renter. I won't go into the details, but it was a dangerous situation, and they had actually resulted in eviction in December, the mid-December, but the paperwork hadn't gone through, and now they cannot do it.
That's right. So it's a double-edged sword here, because there are people that are dangerous and that, just like you talked about, are essentially not paying rent, haven't been paying rent for a while, and that the landlords are being deprived of that opportunity to take their property back at this time.
Yeah, so it goes that far back, and we talk about March 17th, or I can't remember what the date. I think it was March 17th or 19th. We ratified the health order. So we'll go now to further public comment. Thank you, Sheriff.
Hi, this is Greg Holtz from Legal Services Northern California. Madam Chair, Supervisors.
Thank you.
Thank you for looking at the comments we submitted. I'm going to try to restrict my comments to address the questions. With all due respect, I couldn't disagree more strongly with Sheriff Hansel in terms of the legal advice regarding the status of evictions. I would encourage the board to reach out to County Council Billingsley to confirm that interpretation of the law and the facts. My understanding is the court clerk window by drop filing is open, summons can be issued, and the executive order from the governor fatally does not change the 5-day response deadline. It says it should be 60, but clerks are, under the law, they have to issue a 5-day summons. A 60-day summons doesn't exist. And so these are happening. I'm dealing with them. I had 5 to 10 tenants last week who had either 3-day or 30 or 60-day notices served during this public health emergency. So something is needed urgently. The governor's order is narrow, even to the extent it does apply as of tomorrow. If someone, if a tenant did not in writing notify their landlord that they qualify under the executive order, they're not covered anymore. In terms of fairness to landlords, 70% of the mortgages are held by Fannie Mae or backed federally, and those do have protections. Right now, those protections last until December 30th, beyond our 180-day window that we're recommending for repayment, or the end of the emergency. I think I'm running out of time, and I would welcome the opportunity to speak more about any of these issues. But the idea here is that strong protections are needed. I appreciate that Sheriff Hansel is not carrying out the last stage of the eviction, which is locking people out, but we need to give people a substantive defense so they can save their housing, not just delay getting locked out. Save their housing, pay back their landlord, make everyone whole, save their housing, and not create a flood of evictions when this thing is over. I appreciate your consideration of our comments. Thank you.
Thank you. And we have another public comment.
Hi, again, this is Tracy D'Amico, and I have a constituent call ready for you now.
Adopting a local residential eviction ordinance. I do support the ordinance as shown in your staff report. I do not support a more restrictive eviction measure. Regarding the time in which the tenant must notify a landlord in writing within a specific time period that the tenant is unable to pay the full rent amount due to a loss of income related to COVID-19, I believe that 15 days after the rent is due should give the tenant plenty of time. Normally, if someone is not paying their rent, I require it to be notified in advance. They're not paying it, and or I give them 3 days worth of leeway. I think under these circumstances, 15 days should be plenty of time, and it does give time from this ordinance being passed or some form of ordinance being passed on an emergency basis for them to comply. Thank you for my input on this topic.
Thank you.
Thank you very much, everybody, for learning how to use this system, and we'll bring it back to the board. Supervisor Madrone?
I would like to make a motion to direct staff to bring back to us a draft eviction ordinance, taking into consideration all the comments from board members here today, as well as the Realtors Association and other commenters, and to see what happened at the City of Eureka. Basically, to come back with the best approach that we would recommend at the county.
I'll second the motion.
So we have a motion and a second. Supervisor Bohn.
Okay, so you noticed when you came in today that there's nobody in the office, and I know staff is kind of working at home and being fully aware of what we're going through and wanting them to get a hold of landlords and make this. So is this in the next 60 days or 30 days? I don't think, from what I understand, I just had the sheriff stand up there and says, I'm not going to be doing any evictions. So I think time is on our side, and I appreciate the young man, or I guess, or the man from legal services saying that he was wrong. But it doesn't sound like, I mean, that our sheriff was wrong, but I really don't believe that we're going to be doing an eviction. So is there a streamlined effort need to be made, considering we're on skeleton crew, and some of those crews are actually operating in the OES and trying to get us through this pandemic? And I don't know, is this a critical need for right now? Is this just going to have a time frame, or is this just, I don't feel it's a critical need because I think we're addressing it. So that's just my take on it.
Any further comment from the board? Supervisor Bass?
Thank you, Madam Chair. It's like Yeah, I'm curious what others are doing that is beyond, the governor's order. I appreciate Sheriff Hansel. I believe, his interpretation is correct, but then I'm not a legal expert, so that would probably be good to get more information. If we bring the item back, I'm not sure if it'd be, I don't know if we want to take the action to bring it back or just have it initiated again by individual supervisor who perhaps can bring it. I don't know. If it is brought back in any kind of form, I would really like to make sure that we do reach out to landlords, whether it's through the realtors or we have a lot of contacts. So I really would feel better just to get their sense of comfort, because I think they are reacting to something that they just saw and they're just not really sure what it means to them. And so I think, it was nice to give people a sense of security that they're not going to be kicked out of their houses. Definitely, that is something that I believe is important. But I think moving forward on this as it is right now, I just have more questions. I want it to be more of a joint effort, and I would like to bring some other people in. So I don't know exactly what that means, whether this moves forward to come back as some type of item or if it doesn't. I would want it to be a more robust conversation with community members.
Any further comment? I think.
Madam Chair.
Yeah, yes, Supervisor Madrone.
Perhaps I am totally sensitive, as the rest of you are, to staff workload right now. That is a big issue, a very important issue. So perhaps we could ask our acting county counsel, is this a heavy lift or a light lift? Mr. Billingsley.
Yes, through the chair. I don't think an ordinance would be especially difficult. Many jurisdictions have passed them. I don't know that it would be based upon the sample. I mean, portions of the sample would probably be incorporated. But the part that would be helpful would be a little more policy direction and what you'd like to see. I think the two main issues I see are, what would this repayment timeline look like? For instance, Eureka said 180 days. Jurisdictions have gone from 60 to 120. So some kind of policy direction on that. And then also, I think the other cutoff is most of these ordinances only apply for COVID-related reasons, but the proposed ordinance also applies to no-fault evictions. If the board is interested in including that, it would probably take more revisions. But if the more policy direction that could be given now, I think the cleaner version that could come back before your board.
From what I'm hearing from my colleagues, is what we really need is a little bit more of a staff report. I certainly couldn't quite make out from the emails that I got what exactly are the differences between the governor's mandate and what we're trying to do here, what we would be trying to do. I'd like that spelled out more so that I had a better idea of what it is, because right now, as I said, I believe that the governor's action does cover people who have are losing money because of or are unable to pay right now, and because of the pandemic. I don't know how long that's going to go on, how long we're going to be affected, how long people are going to be out of work. I know that our local ordinance is in fact, order is in place until rescinded, whereas the governor's order goes till May 31. So we do have time either way. And I personally would like to see a little bit more of a robust staff report than an ordinance ready for us to go with, because I agree with Council Billingsley. He doesn't have enough direction in terms of policy, and I don't feel in a position to be able to drill down to those levels until I have more information. Supervisor Bohn.
I know I'd have a hard time going more than 90 days just because of some of the things that are said in here about foreclosure and stuff. I think everybody can, but 180 days, I mean, that seems like pretty extreme, and I hadn't seen that in any of the other. And I'm with Supervisor Fennell. The governor's order looks pretty good. And the other thing is, I don't have any levels of how many, like I said, I talked to I did reach out to one of the largest landlords in the county, and he said he had evicted 2 people in the last 5 years. So I think most of them, unless they're hitting 100%, are not. They're not getting rid of people unless there's an extreme problem. And so, and again, no fault compared to, I think sometimes it looks like we're taking, I don't want to look like anybody's taking advantage of the current crisis we're in, but I think we're basing this on COVID issues, COVID financial disaster that's hitting everybody, and trying to make them, I think we talked about one of the biggest things is emotional stress can be as bad, emotional and financial stress can be as bad as any illness you have. So we're trying to alleviate that across the board. So somewhere if we find a happy medium so that landlord and renter who already have probably a good relationship, it sounds like, in most cases that I've seen, Mr. Wilson said he's got a great relationship and he's making it work. I think everybody has that attitude because there aren't people beating the door down. So I don't know how much we really want to go into this rather than it being COVID related. And I'd have a hard time getting on anything more than 90 days. So, and I need input from the landlords. I need input from the landlords to a certain extent, and a little more input from some of the renters to see, where they're coming up with what they're doing. I really appreciate legal services. I've had to deal with them on the Mycroft issue and know how that can go. So I'm aware of the work they do. So I appreciate them writing an ordinance for us, but I don't think we're going to go that route. So that's my input, and hopefully we can come back with a staff report that, is it necessary? Do we have a problem? Is there an issue, or are we even anticipating an issue, or are we trying to create something bigger down the road? So I think it should be COVID related, 90 days max, and go from there. I mean, because the fallback is we still have the governor's order out there. So.
Supervisor Madrone.
Thank you, Chair. I appreciate all the comments and agree with the concerns. Basically, County Council, what I'm looking for is clarity for both tenants and landlords. I think that's what we all want. Some sort of clarity that goes beyond what the governor did and covers everybody as best as it can. I believe the 180 days is related to the fact that it could easily be a 90-day shelter-in-place situation. It's at least going to be 60 days from March 15th to May 15th, if not to May 31st, which is what we're saying right now. So we're at 90 days of shelter in place, and then once that's removed, hopefully, May 31st, then it will take folks a couple of months to get their lives back in order to be able to get caught up on payments and things like that. So I think that's where that comes from. It's just a reasonable assumption. But again, without getting into the weeds, I'm supportive of the direction this conversation has gone, where we would direct staff to come back with a draft ordinance and a staff report that would lay out the details as questions expressed by the board. Is that enough direction to be able to proceed? It's basically the same motion, just kind of clarifying, trying to move us forward. I think it's an urgent thing, but everybody can disagree or agree on that.
Supervisor Wilson?
Just as a clarification, I mean, I would accept that something draft come back, from the staff, from Jefferson, that encapsulates the issues, encapsulates some sort of draft ordinance, but also offers some options that he might be able to anticipate from this discussion and kind of what's even going to happen between today and when this comes back. There may be new information, and board really understand what our options are at that time. That'd be something, instead of just giving us just a ordinance and then saying, asking us yes or no, or to guess on changes that we might have and what those impacts might be, to have something a little bit more filled out. All of this is in the understanding that our staff is stressed at all levels. Even time that we're taking to do these meetings, which are really important, and we're doing the work of doing our public work, we have to understand that our administrative staff is working double time to help out, and be supportive of our OES and public health staff and all that they're doing for the whole rest of the county. So, which is a little different than other municipalities have to deal with, that we as counties, as kind of arms of the state, are having to do. So I just want to acknowledge that, our staff is doing that work. But I do think that if this board decides to bring something back, I would like to make sure that it just has some options in there that fleshes out a little bit of language so that we can make those choices, try and be efficient about our decision making, and effectively, use the advice of counsel in that process.
I wasn't really, sorry, I just took my mute off. I think as long as we have people involved in the conversation, I just want to see a little more input, but that's already been said. And however we fit that in for what Jefferson does, I don't know what that looks like.
Okay, do you have any other feedback, Council Billingsley? Or I think it was pretty clear what you said.
Does the board have any feedback on when they like this item to come back?
Okay. Thank you. So with that, we have had public, oh, sorry, go ahead. I didn't hear it.
Our next meeting is
within 30 days.
Oh, thank you, yeah.
Would it be possible to bring this back next week at our regular meeting on Tuesday?
Probably not if you're seeking input from other parties.
Okay. So.
And just so the board's aware, if you want something to go into effect immediately, it will be an emergency ordinance, and it'll be a 4/5.
Okay, so in 2 weeks, is that reasonable? Yep.
Well, so for clarity, I know we're going back into our regular meeting starting next week. It will not be the same as our old regular meetings. It'll be completely virtual, but we will be having a regular meeting next week with a regular agenda.
Through the chair.
Yes, Supervisor Bohn.
How about 3 weeks? I'll go off of 30. You go off of 2. 3 weeks. Would that be enough time so we get something? I don't want it rushed. I don't want it, and I want the people that are going to be impacted, I want them to have full input, and I don't want to come back in 2 weeks and say, well, I tried to get a hold of them and I couldn't get a hold of them, because everybody's under this current state right now of being shorthanded, limited staff and everything else. So as we get a hold of some of these people that that have input, I think it would be very important that we allow them to have that input.
In the interest of compromise, I'll accept the 3 weeks. I think it's important. I appreciate that. And so let's bring it back.
Okay, that sounds good. And I do want to say that we are going to have a meeting next Tuesday. We don't know how things will unfold. We might or might not have one on the 21st. So just saying, we'll say 3 weeks at this point. And at this time, I'd like to call the vote. And we'll do a roll call.
We'll start with our folks that are attending via Zoom. Supervisor Wilson?
Yes.
Supervisor Bass?
Yes.
Supervisor Bohn? Sure. Supervisor Fennell,
Yes?
Supervisor Madrone,
Yes.
5-0.
Thank you very much, Ryan, for that, and thank you, Council Billingsley, for taking off on that. And I know it will involve other staff as well, so thank you, because we know we're very, very busy. So that will bring us to the next item on the agenda, final one for today, and that is a discussion on postponement of standard penalty waiver procedures for late payment of property taxes. Supervisor Bohn, and I know Treasurer Tax Collector Bartholomew is here as well for this item.
Chair Fennell, I'm going to have to leave right now. I'm going to continue on the phone, but I need to be able to leave the premises right now, so I'll continue with you all on the phone.
Okay, great. Thank you.
Thank you.
Thank you.
Well, I'll make it, this is something I've been asking about since day one because this is one of the economic impacts we're facing, and it's probably one of the top 3 phone calls I've been getting about what we're going to do with taxes. And since there's only 3 things in life guaranteed, we have one of them here that's in charge of it, John Bartholomew. And I have learned more about taxes and what you can do and what you can't do. And I think your second your letter, I think what we're coming down to is, and I think what most people do, if you can pay your taxes, if you haven't been affected, but as I drive up and down 4th and 5th Street and realize that how many people are having economic disparities and are going to be hit with these same efforts, just like the landlords and the renters and things like that. But knowing full well that it's not in our power to waive something like this because so many small fire departments, water districts and stuff depend on us to keep a lot of our rural areas safe, and the water pumping and other aspects along those lines. I like the options you gave us today. I think the one that you gave us without all the documentation so your staff isn't having a backlog. We're not going to check it anyway. We don't have the staff to do that. But I think your explanation, if you can pay it, pay it. And if you can't, we're willing to look at working with you for the next 60 days. So I think that might be the best compromise we can get out of this.
Welcome, Treasurer Tax Collector Bartholomew.
Chair Fennell and fellow supervisors and staff, thank you for bringing this forward, Supervisor Bohn. I think it's an important discussion. And as you stated, local agencies depend on the property taxes to be distributed to them shortly after the 10th. And I would be loath to make any changes to that deadline just because of the fact that so many agencies need that revenue, depend on that revenue, and have budgeted for it. And so the 2 different waiver forms that I submitted for COVID-19, one which would require documentation, which is our standard of operating at this point in time for all previous waiver requests. We have to have proof of the circumstances beyond the individual taxpayer's control in order for us to waive those penalties and fees for late payments. But these are extraordinary circumstances, and that's why I also submitted a draft proposal which would not require specific documentation in support of the reason they are claiming or requesting a tax waiver due to COVID-19, but they would all be signing off under penalty of perjury if what they are stating on this form is not true. My question for County Council is whether or not the documentation in support of their requesting the waiver is a requirement in his legal opinion.
Councillor Billingsley.
Is this in reference to the one-page form that was emailed
Yes.
recently?
Mm-hmm. There's two of them. One says, basically, they're fairly identical. One says, however, please include documentation, and the other doesn't. And then there's also a line that says explanation at the bottom of the one that doesn't require documentation, and then just optional additional explanation.
Thank you, Chair Fennell. That is correct. Just one waiver form requires supportive documentation for whatever the reason may be that they're asking for the waiver. And the second version is no documents required in support of the reason for their waiver request. And so that's the one that I would like direction on, because RNT's Revenue and Taxation Code 4985.2 only requests that the treasurer tax collector, in this case, has a finding which is supportive of the waiver being granted.
Well, I think I'll have to look at both forms and then advise you after this meeting. But I think as long as the direction is that you're authorized to use either form, I don't think that matters. Obviously, it's your discretion to find out if the finding is made or not, but I'll have to look to see as to what level of background documentation is necessary.
4 categories, 5 actually: lost job, compromised health, child care, adult care, homeschooling, closed business, or other, which might be loss of rental income or something like that. So those are the categories, and I guess the question from the treasurer tax collector is it necessary for them to provide documentation to go along with either one of those reasons, by law?
That is correct. And again, these are extraordinary circumstances, and I have been in, our association has a lot of email chatter going on about who's doing what in this circumstance, and certain counties are staying with the documentation required, and others are, it sounds like they may not follow those rules strictly. And so I'm perfectly comfortable waiting to hear from County Council after he has had time to review and looked at what other counties are doing or whatever is needed. But I would request that the waiver request process continue as is and leave it to the treasurer tax collector's office's discretion to make the determination. But I assure the board and the public that I will do everything and anything within my authority to do the right thing relative to COVID-19.
And I would just say to the treasurer tax collector, that's completely within your authority. You do make the decisions about whether or not a waiver is appropriate.
So Jefferson, with that statement, the letter that he's presenting, is that also under his preview? The documentation, you just said it was under his.
Yeah, the process is up to the treasurer tax collector, and tentatively, I think the form with the check boxes not requiring documentation is probably all right, but that's a very off-the-cuff analysis, and I'd want to do a little verification to make sure that's accurate.
So can we vote on that with knowing full well that if you deem it not responsive or not legal, that it would be revoked with a caveat to that being revoked? So we're not, with that being, look at the date today, look the day the property taxes are due. I think we need to have something a little bit more concrete, and I think you're going to be able to get your answer within an hour. I mean, this one's a pretty easy one, so I'd rather just vote on that, and then if you come back with, you know, if we have put an outlier out there that it is not illegal, come to find out it's not legal, then we could rescind or, you know, have that be part of the motion.
Or you could go the opposite way and require the documentation and then come out and say, we don't need it. Then you're totally covered.
Chair, if I may, I think the issue is that the treasurer is in charge of the documentation.
Yeah.
I don't know what the board would be actually voting on. I really just need, my office needs to give advice to the treasurer.
Then basically is to support the treasurer in granting a waiver of their usual penalties and fees regarding a late payment.
I think that would be
appropriate. From my perspective, I really appreciate the support in the situation, and I guess this item is really just a discussion item at this point, and so I would just like to hear from any other board members that have comment whether or not they are supportive of one document or the other. I am, like I mentioned, these are extraordinary circumstances, and I believe that the documentation or not being required is really a judgment call. And in this circumstance, and this would be the only circumstance that I would even propose no documentation being required. But obviously the discussion today has shown how extreme the circumstances are, and so it would save on staff time for reviewing all of these waiver requests, and I do anticipate quite a few. But at the same time, we are collecting a lot of payments daily. In fact, we have 4 trays of mail sitting in our vault right now waiting to be processed. We've already processed over $500,000 in payments today, and so we are receiving a lot of payments, and I anticipate that the vast majority of people that are able to pay will pay on time because they want to, they can do it, so they will. They're doing the right thing. And so I think that we may be emphasizing what might happen here. I don't think there will be a lot of people that don't pay even though they can. I would hope that they would pay when they can, but for the sake of expediency, I think it worthwhile to have the option to not require the documents, and I await for County Council's recommendation as to which direction I will go with the discretionary authority that this office has. And if it is determined that documentation is required, then that is the form that the Treasurer Tax Collector's Office will use for granting waivers or not.
Thank you. Are there other members of the board that would like to address this issue? Supervisor Wilson?
Sure. I just want to say I support the tax collector in this understanding issue. As someone who's paying property taxes myself and has a tenant that's having issues, and so there's an impact with relationship to that. So I completely empathize, but I do think that Mr. Bartholomew has come up with a reasonable compromise, considering not just the situation but the impacts, the sort of downstream impacts of what non-payment really can mean to not just really the county as an institution, but all of the institutions that get direct payments from that. And so, and I do believe that most, a vast majority of taxpayers and property taxpayers will do the right thing and do what they can to I'm supportive of the tax of of Mr. Bartholomew in.
Thank you, Supervisor Wilson. Supervisor Bass? You're fine? Okay.
I'm fine. I just thought I'd, at least know I'm still here listening. Hey, this is a very strange process as far as these meetings go. I have total trust in the treasurer, tax collector.
Okay, thank you. Supervisor Madrone?
I support your request as well.
So with that, do we make a motion supporting, I'd like to make a motion supporting suggestion 1 from our, well, actually, I'll just make a motion that we support the tax collector, and I like the way he's headed with it.
We have a motion and a second. Is there any public comment on this item? No public comment. Bring it back to the board and we'll take a roll call again.
Supervisor Wilson?
Yes.
Supervisor Bass?
Yes.
Supervisor Bohn? Yes. Supervisor Fennell?
Yes.
Supervisor Madrone?
Absolutely, yes.
5-0.
Thank you very much. Thank you to everybody. This is our first virtual type meeting. And again, it's an emergency one. We will have our regular meeting next Tuesday, and it will also be a virtual meeting. Everybody stay safe, practice social distancing, stay at home, please, and wear your masks if you're going to congregate with more than your family. Thanks a lot. We are adjourned.